There's a cancer that often grows in complete silence. It hides deep inside the body, behind the stomach, in a place where pain rarely reaches the surface until it's too late. By the time most people realize something is wrong, the disease has already spread. That's why pancreatic cancer is often called the silent killer. And it's also why what you're about to learn could one day make a real difference, either for you or for someone you love. Here's the truth that very few people talk about. The pancreas does send warning signals. The problem is that those signals are easy to miss, easy to dismiss, and easy to confuse with everyday issues. But once you know what to look for, the picture becomes much clearer. In the next few minutes, you'll discover 12 symptoms that could be your body's way of asking for attention. Some are surprising, some are subtle, and a few of them could quite literally save a life. Let's get into it. Before we get to the symptoms, it helps to understand what the pancreas actually does. It's a small, pear-shaped organ tucked behind the stomach, and it has two essential jobs. First, it produces enzymes that help your body digest food. Second, it releases hormones like insulin that control your blood sugar. When something goes wrong with the pancreas, both digestion and blood sugar can be affected in ways that are easy to overlook at first. The reason pancreatic cancer is so often diagnosed late comes down to its location. The pancreas sits deep inside the body, hidden behind other organs. A small tumor can grow there for months, even years, without causing obvious pain or visible changes. The early symptoms are vague, and most people assume they're caused by stress, diet, or aging. It's important to remember something here. The symptoms you're about to hear can have many different causes, and most of the time, they are not cancer. But certain patterns matter, certain combinations matter, and recognizing those patterns early can change the entire path of someone's health journey. So let's begin with symptom number one. Symptom number one, unexplained weight loss. This is one of the earliest and most common warning signs, and yet it's the one people are most likely to celebrate instead of question. If you're losing weight without trying, without changing your diet, without exercising more, your body is telling you something. With pancreatic cancer, weight loss happens because the tumor interferes with digestion and changes how the body uses energy. The pounds can come off quickly, sometimes 10, 15, even 20 in just a few months. If the scale is dropping and you don't know why, that's a conversation worth having with a healthcare professional. Unexplained weight loss is never something to ignore, no matter how welcome it might feel at first. Symptom number two, loss of appetite. Closely related to weight loss is a sudden and lasting change in appetite. People describe it in different ways. Some say they feel full after just a few bites. Others say food simply doesn't appeal to them anymore. Favorite meals lose their taste. Hunger fades. This happens because a tumor in the pancreas can press against the stomach or disrupt the digestive enzymes your body needs to process food. When appetite changes last for more than 2 or 3 weeks without an obvious reason, it's a signal worth paying attention to. Your body usually knows when something is off, and a sudden disinterest in food is one of the ways it speaks up. Symptom number 3, persistent fatigue. Everyone gets tired. But the fatigue connected to pancreatic cancer is different. It's the kind of exhaustion that doesn't go away with a good night's sleep. It doesn't lift after a weekend of rest. It settles in and stays day after day, draining your energy in a way that feels deeply unusual. This kind of fatigue can happen because the body is working overtime to deal with a hidden problem and because nutrients aren't being absorbed properly. If you find yourself constantly drained, struggling through tasks that used to feel easy, and there's no clear reason why, don't brush it off as stress or aging. Persistent fatigue deserves a closer look. Symptom number 4, upper abdominal pain that radiates to the back. This is one of the most classic patterns associated with pancreatic cancer, and it's one of the most important to recognize. The pain typically starts in the upper part of the abdomen, just below the ribs, and slowly wraps around to the middle of the back. It can feel like a dull ache, a deep pressure, or a gnawing discomfort. Some people notice it gets worse after eating or when lying down, and a little better when leaning forward. The pain happens because the pancreas sits very close to important nerves and other organs, and a tumor can press against them as it grows. This kind of pain, especially when it's persistent and unrelated to a known cause, is a strong reason to seek medical evaluation. It's one of those signals the body sends that should never be silenced with over-the-counter relief and forgotten. Symptom number 5. Jaundice. Jaundice is one of the most recognizable warning signs and one of the hardest to ignore once it appears. It shows up as a yellow tint in the whites of the eyes, and as the condition progresses, the skin itself can take on a yellowish color. This happens because the pancreas sits very close to the bile duct, the small tube that carries bile from the liver into the intestine. When a tumor grows in the head of the pancreas, it can block that duct, causing bile to back up in the body. The result is a buildup of a yellow substance called bilirubin. Jaundice that appears without any clear cause, especially in someone over the age of 50, is a major red flag and should always be evaluated by a healthcare professional as soon as possible. Symptom number 6. Dark urine and pale stools. Often appearing alongside jaundice, this pair of symptoms tells a similar story. When bile can't flow normally into the intestine, the body has to get rid of it some other way. So bilirubin starts coming out through the urine, turning it a deep amber, brown, or even tea-colored shade. At the same time, stools lose their normal brown color because bile isn't reaching the digestive tract the way it should. They can become pale, clay-colored, or almost white. These changes are easy to spot if you simply pay attention. And while there are other possible causes, the combination of dark urine and pale stools, especially when paired with yellow skin, is a pattern that needs immediate medical attention. Symptom number 7. Itchy skin. This one surprises a lot of people, but it's directly connected to the same problem behind jaundice. When bile salts build up in the bloodstream, they can deposit in the skin and cause widespread, persistent itching. It's not the kind of itch you get from dry skin or a mild allergy. It can be intense all over the body, and it doesn't respond well to lotions or typical remedies. The itching often appears before the yellowing of the skin becomes obvious, which makes it an especially valuable early clue. If you're suddenly itching everywhere without a clear reason, and it's lasting for days or weeks, that's something worth bringing up with a healthcare provider. Symptom number 8. Nausea and vomiting. Occasional nausea is part of life, but persistent nausea, especially after meals, can be a sign that something more serious is going on. With pancreatic cancer, a tumor can press against the stomach or the upper part of the small intestine, partially blocking the path that food needs to travel. This makes it harder for the stomach to empty properly, which leads to a feeling of fullness, queasiness, and sometimes vomiting after eating. Some people also feel bloated or uncomfortable even after small meals. When nausea becomes a regular part of your day, when food starts to feel like the enemy, your body is telling you that something deeper deserves attention. Symptom number 9. Changes in stool, especially greasy or floating stools. This is one of the most overlooked symptoms, but it can be one of the most telling. The pancreas produces the enzymes your body needs to break down fats. When a tumor blocks or damages the pancreas, those enzymes can't reach the intestine the way they should. The result is that fat passes through the digestive system without being absorbed. This causes a condition called steatorrhea, which simply means fatty stools. The stools may look greasy, oily, or pale. They often float, stick to the side of the toilet bowl, or have a strong, unusual odor. People also notice them more difficult to flush. If you're seeing this pattern in your bathroom on a regular basis, it's not something to feel embarrassed about. It's something to talk to a healthcare professional about. And while we're on the subject of digestion, there's something important I want to share with you before we move on. If you've been struggling with bloating, sluggish digestion, or you simply can't seem to go to the bathroom regularly, no matter what you try, you're not alone, and the answer might surprise you. Recently, researchers have been talking about a strange 8,000-year-old underwater gut superfood that has been used by more than 3 billion people around the world. Just one small pinch of it before a meal can help soothe the gut, restart proper digestion, and help the body eliminate up to 10 pounds of toxic buildup that may be quietly clogging the intestines. And here's what defies common sense. It works even without fibers, without restrictive diets, without expensive probiotics, and without medications. If this sounds like something you or someone you love could benefit from, point your phone's camera at the QR code on the screen right now to watch the full presentation that explains exactly how it works. You'll also find the link pinned at the top of the comments below this video. Take a moment to check it out. It could be the missing piece your digestion has been waiting for. Now let's get back to the warning signs, because the next one is one of the most overlooked of all. Symptom number 10, new onset diabetes or sudden worsening of existing diabetes. This is one of the most important and underappreciated warning signs, especially in adults over 50. The pancreas produces insulin, the hormone that controls blood sugar. When a tumor disrupts that process, blood sugar can rise unexpectedly. Sometimes diabetes appears suddenly in someone who has no traditional risk factors. Other times, a person who has managed their diabetes well for years finds that their blood sugar is suddenly out of control for no clear reason. Research has shown that new onset diabetes in older adults can sometimes be the very first sign of pancreatic cancer, appearing months or even years before other symptoms. If you or someone you love has recently been diagnosed with diabetes later in life, especially without the usual risk factors, this is a conversation worth having with a healthcare provider. Symptom number 11, blood clots, especially in the legs. Pancreatic cancer can affect the way the blood clots, increasing the risk of dangerous clots forming in the deep veins of the body, most commonly in the legs. This condition is called deep vein thrombosis, and the signs include swelling, warmth, redness, and pain in one leg, often in the calf. Sometimes the first sign of a clot is a pulmonary embolism when the clot travels to the lungs, causing sudden shortness of breath, chest pain, and a rapid heartbeat. This is a medical emergency. While blood clots can happen for many reasons, an unexplained clot, particularly in someone with no obvious risk factors, can sometimes be one of the earliest signals that something serious is happening inside the body. Symptom number 12, depression and sudden mood changes. This final symptom often catches people off guard because most of us don't connect emotional changes with a physical illness. But research has revealed something striking. Many people diagnosed with pancreatic cancer experience new symptoms of depression, anxiety, or mood changes in the months leading up to their diagnosis, sometimes before any physical signs appeared at all. The exact reason isn't fully understood, but it's believed to be related to inflammation and certain chemicals released by the tumor that affect the brain. A sudden, unexplained shift in mood, especially when combined with any of the physical symptoms we've discussed, is another piece of the puzzle that shouldn't be ignored. Now here's something important to keep in mind. Noticing one of these symptoms on its own is rarely a reason to panic. Each of them can be caused by dozens of different conditions, most of which are far less serious than cancer. What really matters is the pattern. Symptoms that last more than 2 or 3 weeks. Symptoms that appear together. Symptoms that don't have a clear explanation. That's when it's time to take action. If you recognize any of these signs in yourself or someone you love, the most powerful step you can take is to schedule an appointment with a healthcare professional. Be honest, be specific. Describe what you've noticed, when it started, and how it has changed over time. From there, a doctor may recommend blood tests, imaging like a CT scan or MRI, or a specialized procedure called endoscopic ultrasound to take a closer look at the pancreas. Early detection truly changes everything with this disease. The earlier pancreatic cancer is found, the more options exist for treatment, and the better the outcomes tend to be. You know your body better than anyone, When something feels off, trust that instinct and follow up on it. If there's one message to take away from everything we've talked about today, it's this. Knowledge is your first line of defense. Pancreatic cancer is often called silent, but the truth is that the body almost always whispers before it shouts. The challenge is learning to listen. And now you know what to listen for. These 12 symptoms aren't meant to frighten you. They're meant to inform you, to give you a clearer picture of what your body might be trying to say. Most of the time, these signs will turn out to be something far less serious. But every now and then, recognizing them early can make all the difference in the world. Consider sharing what you've learned today with the people you care about. A simple conversation with a parent, a friend, or a partner could plant the seed of awareness that saves a life one day. Take care of your body, pay attention to its signals, and never underestimate the power of listening.